All right, today our first presenter is Mr. Evan Bobo.
Good morning, my name is Evan Bobo and I'm going to talk to you about my career path as an orthopedic surgeon. You might be wondering, what is an orthopedic surgeon? An orthopedic surgeon examines, diagnoses, and treats diseases and injuries to the musculoskeletal system. It prescribes course of treatment for patients with injuries, disorders, or malformations and performs required surgery. It also conducts and supervises direct patient care, including some non-surgical treatment options. In simpler terms, if you were to get injured and break your arm or something to that effect, and the doctor tells you to go see a specialist for surgery or further examination, that would be me. Why did I choose this career? I love to help others, and I also have past experiences with this. My sophomore year, I tore my ACL playing basketball, and I had to go through the whole process of recovery with physical therapy, surgery, and all that stuff to get back to be able to play. And I saw how much of an impact it had with me, so I would love to be able to do that for other people. And I had great role models at the hospital that I went to. I had a great doctor and a great physical therapist. How do you become an orthopedic surgeon? First, you have to get a high school diploma, and then you have to go to college to get a bachelor's degree in a science field, and that takes 4 years. Mine will be biology. I'll be going to get biology. And then you have to go to medical school. That also takes 4 years. And then residency, that takes 5. And you can do fellowship. It's optional. It's usually around a year, and you get specialized further in orthopedics. So I'd probably do that too. And then you find a job. So as you can see, this is a pretty long process. So for my first 2 years, I'm going to go to Cleveland State to get a general transfer degree in biology, and then transfer to the University of Tennessee in Knoxville. What is the pay? In the United States and in Tennessee, they change a little bit. In the United States, the average is $506,000 a year. And in Tennessee, the below average, the 25th percentile, is $362,000 a year, and the average is $460,000 a year. And above average is $595,000 a year, so right at $600,000 a year. What benefits do orthopedic surgeons get? They get health, vision, and dental insurance. They get professional liability coverage. They get paid time off, and they get great retirement plans. And sometimes your employers will match your retirement plan. What are the working hours? Surgeons work for 50 to 60 hours per week, which does not include their on-call hours. Most hospitals and private practices don't allow surgeons to work over 80 hours a week, including on-call hours and researching hours. Where can you get this job? You can mostly any hospital, university, medical center, or you can start your own private practice. I would like to start at a hospital, gain experience, and save money to eventually open up my own private practice somewhere local here. What companies offer the job? Tenova Jefferson Memorial Hospital in Jefferson, Tennessee, or Jefferson City, Tennessee. Park Ridge Medical Center in Chattanooga, and Tenova Healthcare in Cleveland, which is right beside where I had surgery. How can my career portfolio help apply for the position? It has my resume, letters of recommendation, and reference in that. And it also has my achievements so far in life and my medical records. You have to have an internship. Yes, after college and medical school, orthopedic surgeons are required to do a 5-year residency. So this is my budget chart. Right now I have a small income of $200 a month. And I have negative $517 for my fixed expenses and negative $780 for my controllable expenses. And that leaves me at negative $1,100 for my balance. That's it for my presentation. Are there any questions?
How many years are you expecting to be in school?
Well, you do 8 years of complete, schooling, and then you have to do 5 years of residency after that. So that's more on the job training, so.
Do you get paid during residency, and what is your backup plan?
I think you do get paid a little bit in residency. It's nowhere near as much, but they do give you a little bit of a salary. My backup plan, I would like to still use my biology degree and become a science teacher and a basketball coach.